Hello and welcome. I'm Anjali and you're watching Zee Companion. And today we're talking about your skin and how you can take care of it in the sun. You might be wondering what to do to take care of your skin if you're going on holiday. You might even be questioning if you need to do anything at all. Maybe you're one of those people who thinks, I don't need sunscreen because I'm South Asian, I've already got darker skin, I'm naturally protected. But what if you're wrong? What if you actually do need to take care of your skin, and that by doing so, you could actually slow down your aging process and ensure that you grow older with graceful, beautiful and radiant skin? Well, in the studio this evening, I'm joined by Dr. Dev Shah, who is a consultant dermatologist. He's also a specialist in Mohs surgery, and he's been in dermatology for over 15 years, and he is able to treat any skin condition. So apart from going away on holiday and being exposed to the sun, if you have any other skin condition or complaint, something that you're worried about, something that you'd like to ask to an expert or a specialist, then Dev is here in the studio to answer your questions. We would love to hear from you. It's free to call 0800 408 6700, and our lines are open until 7 p.m. So please do give us a call and have your questions answered. Dev, thank you very much for joining me this evening.
Pleasure.
Really appreciate having you here.
Okay.
So we are talking about taking care of our skin, and we have been focusing on summer because of the time of year that we're at. Now, how important is it for South Asians to take care of their skin? Because there is that myth that we don't really need to do that, we don't need to use sunscreen. Is that true?
Okay, so when we say South Asian, there are a range of skin types. There can be very light complexions, so skin type 2, people who do burn easily when in the sun for prolonged time, and very dark skin types who don't really burn very much. However, none of these skin types are immune to skin cancer. So we need to be wary of developing skin cancer, and people need to be aware that you're not completely immune. You're less likely to get it, but you're not immune. And to regularly check your body is an important thing that we must do on a monthly basis.
And when you say check our bodies, what sort of things do we need to look out for?
So firstly, how to check your body. So we check our bodies by looking at every part, so rifling through your hair, getting a partner to look at your back, looking at your hands, looking at your feet, looking at your nails, looking in every nook and cranny. It's something that we don't do as humans, and it's important to do that on a monthly basis. Because if you know your body, you will know whether you get any new blemishes, whether blemishes are changing, and the sorts of things you want to look out for if blemishes are changing or spots are changing are if they're growing in an asymmetrical way, if they're developing lots of different colours, if they're bleeding or giving you symptoms like pain or becoming larger in a quick manner, and if their borders are regular, or if they're getting blurred or they're scalloped borders. These are the sorts of things that you should go and see your GP about. Okay.
And the GP would be the first person to speak to about these?
Really, in general, because if they think that this is worrying, they can refer you on to us.
Okay.
And in general, if there's a worrying feature, you will get to see us, a dermatologist, within 2 weeks. That's our referral pathway across England and Wales. So.
How at risk are we of developing skin cancer as a South Asian community?
So we have a low risk of developing skin cancer in general, so much lower. The problem is that when we do develop skin cancer, we generally develop it at a later stage because we don't recognise it as skin cancer. So whilst we're far less likely, for example, melanoma, which is the skin cancer that can kill people, that can present at a much later stage when it's spread, because no one really thinks that they're going to get the melanoma.
Right.
So it's about having that in your mind, I'm still able to get it. And the classic example is someone like Bob Marley, for example. He died of a melanoma because he didn't think he would get something like this.
Right.
And it was felt to be a blemish on his toe. And that's eventually what killed him. So it does happen in darker-skinned patients, and it's something to be aware of, but not overtly worried about, something to monitor.
And it just emphasises the importance, really, of taking care of our skin, especially with sun exposure.
So sun exposure has. So if you're aware of your body, that's great. But now let's look at sun protection. So what do you do if you want to sun protect your skin, and why do you need to do it? the biggest cause of aging or premature aging is excessive sun exposure, ranging from every skin type. Now, whilst Asians will age far less quickly than paler skin types, if you do practice adequate sun protection, then you will age at a slower rate.
Right. So now that obviously includes use of sunscreen.
Yes.
Now, how do we know what kind of sunscreen is the right thing for us?
So, in general, sunscreens prolong the time you can stay in the sun until you burn. So it really depends on... there is no one answer fits all, because it depends on your skin type. And we have developed lots of leaflets that are available on various websites that show what type of skin you have. And in general, we recommend a sunblock with an SPF, so that blocks one type of UV radiation, of 30 to 50.
Okay.
And then with a high UVA rating. So that blocks the two types of sun rays that can cause skin aging.
Now, in England, we don't really see a great deal of sun. So does that mean that maybe if there's one day when it's sunny, we don't need to wear sunscreen? Can we get away with not wearing it?
You probably can, but the sun in England is intense, and it's because it's cool here. So it's still coming through, even on cloudy days. Even when it doesn't feel cold, you still have quite an intense sun. And therefore, just because you don't feel hot, it doesn't mean the sun's not intense. Just because we've got a nice strong wind blowing,
right, because
we're an island nation, doesn't mean that you're not getting sun damage. So regular use of a sunblock is recommended if you really want to prevent signs of aging.
Right. Now, what about, for example, I also hear about moisturisers. There are so many moisturisers to choose from, and some of them are incredibly expensive, and we do buy into the idea that the more money we spend on a moisturiser, the better it should be. Is that the case?
In short, no, it's not the case. So a moisturiser is a mixture of an oil or, with water, and all the moisturisers we have are different balances of oil with water. So, again, you have to find the sort of moisturiser that suits you. There is no point in having one that's very greasy if you've got very greasy skin.
Right.
Equally, you have to find a moisturiser that you will use. There's no point in having a horrible one that smells horrible to you, because you're not going to use it.
No, of course.
So moisturisers are very personal. They're like clothes, they're like perfumes. They are a very personal choice. And we as dermatologists can prescribe up to 100 different moisturisers, and we often go through about 5 or 6 with our patients. And we find the one that they like, because that's the most important.
Of course. Now we have someone on the line who would love to ask you a question, Dev.
Okay.
Hello there, what's your name?
Hello, my name is Sarla.
Hi Sarla, thank you for calling.
Hi.
Thank you. I just want to ask a question to doctor.
Please, go ahead.
Yeah, I went to India in 2008, and in my hand the skin has been burnt. And since then, you know, I'm having itching all the time when I go in the sun, and it's dark color, you know. So what can I do?
Okay.
So is it one side or both sides that you've been...
One side is worse and one side is a little bit less, yeah.
And did you say you got burnt from the sun, or did you have some sort of other burn?
No, only in my hands from the sun, because it was too hot up there.
Okay. And that was back in 2008, is that right? And you're still getting problems now?
Yeah, as soon as I go in the sun, and if I try, it started itching me.
And is that only on your arms, or is it on your face as well?
No, in my arms only.
Okay. Well, you probably have a condition called polymorphic light eruption, where it never tends to affect the face, but always affects non-sun exposed areas. So this tends to happen to patients around the spring and summer times, and it's when people start to expose their forearms and suddenly they react to the sun. It's very easily treated with a strong topical steroid for up to 5 days, and if you have no benefit with that, we can prescribe you tablets as well as even light treatment to try and harden your skin before the summer months.
Okay.
Tara, does that help you?
Yes, and how can I contact you?
You don't necessarily need to see me, but any dermatologist would be able to help you, and you could go via your GP, who can refer you on to your local department. It's nice to hear from you. Good luck.
Thank you, Tarla. Thank you very much for getting in touch.
Bye.
Thank you. Bye-bye. So really, the GP, if you have any skin condition, it's important to see your GP first, and then they can refer you on to a dermatologist.
I think that's the best way, and it's the way the NHS works.
Yes, of course.
In the UK.
Okay, that's actually something that I wanted to talk to you about, is in terms of, are these skin conditions hereditary? And Ashok, thank you very much for getting in touch and actually raising that point, because there are possibly some things that you can't really do anything about. So even if you use sunscreen, perhaps, you can't avoid certain things. Is that the case when it comes to skin?
If you have, genetics and environment all act on us to cause diseases. So if you have the type of genetics that you're predisposed to getting, for example, skin cancers, or, for example, acne, any condition, it depends on your environment, and sunscreens are not going to be the answer for everything.
Sure. Now, we have someone else who'd love to ask you a question, Dev. Hi there, what's your name?
Hi, my name's Ashika.
Ashika, thank you for calling.
Hi.
Hi.
What's your question?
My question is, I've had eczema since I was about 12 to 13 years old.
Okay.
And it just doesn't seem to be going. It's seasonal, so sometimes it's better in winter, and sometimes it's worse in winter, and sometimes it gets better in summer, but sometimes it's worse in summer, so it ranges over the years.
Okay.
I'm also getting like little spots everywhere as well. I went to my GP, and he said that it's folliculitis.
Okay.
Mixed with eczema.
Okay.
And I was using fusidic acid fusidin cream.
Right.
And it's just not shifting. And I find that if I use more like paraffin-based products like Cetraban, Dipropace as emollients, I think it makes me scratch more, because I think it's the paraffin content is quite high.
Okay. So eczema is a difficult condition to cure, but we can control things, and it sounds like you are poorly controlled at the moment, and something that we could help you with. So, unless have you ever seen a dermatologist?
Yeah, I've been seeing dermatologists so many times.
Okay.
I just find myself going back and forth. I was put on flucloxacillin for about 3 to 4 months. Okay. And it didn't really shift it.
Can I ask how old you are now, Ashika?
25.
25. So it sounds like you're of the age where we can use other tablets. They may be slightly longer-term tablets, or we could even use light treatment. So you have a range of treatments still available to you, and I would discuss them with your dermatologist to say, look, I'd like something more aggressive and more longer-term. But it's not something that you'd need to lose hope with. It's definitely treatable.
Okay.
Does that help, Ashika?
Sorry?
Does that help you?
Yeah, it does help me.
And definitely, I think it's a wise idea to see your dermatologist and definitely ask for something more. If what your experience isn't working, it's okay to ask for something else.
Absolutely, of course it is. And they will be very receptive to you saying that you're not happy with the way progress is being done.
But I just find myself going back and forth, like just getting several different types of steroids and several different types of antibiotics. And I don't know, perhaps, do you reckon there would be anything that would be really good? That
I think so. I think that you've had the maximum treatment in terms of creams and antibiotics, and there are other things that are higher up which have possibly more side effects, but are worth trying and worth discussing with your dermatologist.
So Ashika, thank you very much for getting in touch. Really appreciate that. And please do see your dermatologist, and also get back in touch with us and let us know what he's prescribed you, and just see whether that makes a difference or not. Thank you so much for giving us a call. Now we have someone else who'd like to speak with you.
Okay.
Hello, what's your name?
Oh, hi, my name's Priya.
Priya, thank you for calling.
Priya.
Hello there, hi. I've got actually a question to consultant Dev.
Yes, go ahead.
Hi, Dev.
Hi.
Hello.
Right. I just wanted to ask you, basically, for the past few months, I started suffering from, it's like, they say it's called hand eczema.
Okay.
And it's called, the term is called pampholics.
Yes.
Pampholics eczema, and it started appearing like a sort of like a blistering, on the side of my hand, on the palm. And it's been sort of on and off, and I have been prescribed the oral steroids and various other, Damvet, which is another type of steroid, I believe.
Okay.
And I've been suffering for the last 3-4 months already, and I've been waiting for a patch test as well.
Okay.
But I really doubt if it's something that I'm touching which is causing it, because it stopped, it would stop for a couple of weeks or a month, and then it would start, and it would pretty much go quite badly, it would just flare up quite badly.
Okay.
So I really don't know what to really do, or you think I should just wait for a patch test?
I think that Pampholics eczema is...
sorry, I'm going to interrupt you. Priya, thank you very much for your question. If you can give a very brief, because we're coming to an end right now, if you
Sure.
can give a very brief answer, and then what we'll do, Priya, is we'll give you a call after the show, and then Dev can give you a more detailed answer if
I'll
that's
call you
okay.
later.
Thank you for getting in touch. A little brief, maybe 10, 20 seconds if you have, and then we'll need to close up, unfortunately.
Okay, so bottom line is examine your skin regularly. The best anti-aging product out there is a sunscreen, and use a regular moisturizer. Wash your face and body twice. Wash your face twice daily, and look after your skin.
Okay, thank you, Dev.
Thank you very much.
Thank you very much for being with us in the
Thank
studio.
you.
I'm so sorry our time's come to an end so quickly,
fine.
but really appreciate having you here
Thank you
with all
very
your
much.
wisdom for us also.
Okay.
Thank you so much to all of you who've tuned in, and to our callers for your wonderful questions. We have 3 things that we would love for you to please take away from this show. First of all, important thing is regular examination. Check your skin. Only you know if there are any changes that need to be seen with a GP. Lifestyle choices are really important, so really good diet, avoiding smoking, and also good cleansing and moisturizing routine, and using sunscreen as well. And also do gradual treatment, so be very gentle with your skin, and whatever treatments you take, remember it takes time, 3 to 6 months at least, to give yourself that time. Thank you again for watching this evening. If you have any other questions, you can email us, zeecompanion@zeetv.co.uk. Thank you for watching, and good night.